Hi, let's talk about the reasons to see a periodontist for supportive periodontal therapy. When you complete periodontal treatment, or even when you've completed implant treatment, there is maintenance that needs to be done after that. What's the maintenance? Well, if it's a car, it's changing the oil, changing the filter, doing those types of things that you need to do to make sure the car works. Same thing happens with your mouth. You need to have periodontal maintenance done. That means cleaning and cleaning below the gum line and checking below the gum line to make sure that the disease hasn't recurred. Now, for some people, we see them all the time. They're brittle periodontal cases. What do I mean by brittle? They tend to relapse fairly quickly, and we want to catch them early so they don't lose attachment. What do I mean by lose attachment? Lose the bone support for the teeth. If we can catch that early, we can help keep your teeth much, much longer. And of course, our goal is to keep your teeth for a lifetime. There are sometimes that our patients will ask us, can I see my general dentist for all my periodontal maintenance care? And I want to go over some literature with you which states the reasons why you should see a periodontist for periodontal maintenance. There were 3 major studies that have been done on supportive periodontal therapy, done in the periodontist's office or done in the generalist's office. And the way the measurements were done and the way we do our measurements is based on clinical attachment loss. How much bone support has been lost over the period of time of supportive periodontal therapy. Now, the studies, for the most part, were done over a 3-year period of time. And what they did was compare a group of patients that saw general dentists for supportive periodontal therapy and the other group seeing periodontists for supportive periodontal therapy. Now, those that were seeing periodontists lost attachment to a degree of about 0.1 to 0.2 millimeters. Very, very small amount. Those that were seeing generalists for the supportive periodontal therapy lost 10 times as much, about 2.2 to 3 millimeters of attachment. So the periodontist, just a little bit of attachment loss, 0.1, 0.2. Those seeing the generalist, 2 to 3 millimeters. That's a significant difference. Now, of course, the whole goal in periodontal therapy is to keep your teeth. Otherwise, why would you be doing that? When we see our patients here, some of our patients are not brittle. Some of our patients are stable. And at that point, I feel very comfortable at referring you back to the general dentist for supportive periodontal therapy. And we do something called alternating recall. That means that you'll see us in 3 months, see your general dentist in 6 months, us again in 9 months, general dentist in 12 months, and just alternate back and forth. And as long as we're able to maintain you and see that things are staying the same, we do that by periodontal probing, that probe we place below the gum line, then I'm comfortable with that. And the reason I'm comfortable with that is because you've hired me to save your teeth. Now, for some patients, they stay stable for such a long period of time that I might only see them once a year. Other patients we see every 3 months. Most of our patients we alternate every 3 months. And yes, it's my judgment call, and the judgment call is there to help you. Now, I know it costs a little bit more to see us because of the tools we use, the amount of time that we have, and of course, you know the materials that we have and what our hygienists use in our office. But if your goal is to keep your teeth for as long a period of time, there are 3 articles, and I'll be happy to show you those articles. This is the summary of the articles that I can show you to indicate that it's probably a good idea to stay in our office and at least help me direct your periodontal maintenance care to make sure you keep your teeth for as long as possible. Okay? Any questions you have about that, don't hesitate to contact me.